In first year, I haven't really heard too much about this term.
Something to do with a number of competencies within medical education that would have to be that are mandated and would have to be met in order for someone to graduate from medical education in Canada.
It's something that's come up a lot in the context of residency interviews. And so a lot of the places that I've interviewed at, they've talked about this idea of switching towards a competency-based medical education from our current system.
It's evaluations based on how people perform, either, I'm guessing, in more clinical settings versus classroom or exam-based.
Exposing undergraduate students to it sooner than later is better overall.
It is what you do that matters, not how much time you spend in that one thing.
The way residency has been run in the past has been basically you do your time and at the end you graduate. Competency-based is more like you have to prove that you're competent in certain areas before you can move on.
A way for students to learn at their own pace and to maybe take learning into their own hands as well.
That CBME is more focused on milestones and assessing the needs of an individual learner.
We do have that kind of curriculum in first year, but I just never knew it was called that.
We have different objectives for every lecture of what we should learn and objectives for courses in general.
People finishing residency programs at different times and stuff, I really think that's a huge misconception. The idea is that it's probably going to stay a standardized length of time. Within each component of the program, people will finish those different components at different speeds.
I think it really gives us a chance for us to develop our own skills at our own pace.
I think one of the biggest advantages is that it's more focused on what doctors will be performing in the future as opposed to how much they can memorize at the moment.
I think it would develop a lot more confidence in my ability to practice.
Right now, if I get a certain mark on an exam, I might not know what necessarily I'm weak in. What I could be improving on, whether there's a certain part of something I'm not understanding. I've just been told that I know 70% of the material.
I think what's also really emphasized is the practical aspect of competency-based medical education. You have to demonstrate your ability to do something.
Then I think it's great. I mean, how else can we evaluate people being better, like good doctors versus good students?
CBME requires a lot of resources. It requires a lot of flexibility in the program, very taxing on a system that's very static at this time, and there'll be some resistance to it, I think.
Once you've identified someone's needs, you have to try to reach those. So there may need to be extra services to be able to do that, or extra time one-on-one, for example.
Very goal-directedness, and sometimes lose sight of, why we're in medicine, why we're seeing the patient. Instead, you kind of see a check mark, okay, I have to insert a Foley catheter in this patient, versus why is this patient here, why do they need a catheter in the first place?
A lot of my questions and concerns are really in the execution and the logistics of the program, especially in evaluations and how that will affect us as trainees.
It could definitely have an impact maybe on what program I even choose, because if you do have a fear of maybe having a residency that's supposed to be 5 years take even longer because CBME is in place, it could maybe make it a more competitive environment as people are trying to maybe get through things faster.
If I'm not interested in a certain area, if I'm told I have to have this level of competence in an area, I'm never going to practice it. Forcing me to become really, really good in that one area, and they're not going to let me move on until I've done that area, kind of doesn't really resonate with me.
It's been viewed as something that is evolving and something that can strengthen our healthcare system and our medical education system.
I think that our colleagues and our educators would want this to be implemented simply because there's a significant amount of evidence to suggest that this is the way to achieve better outcomes in education.
I think it is kind of the future of where medical education is going. And so if that's where it is deemed to be the best way to train physicians, I would like to be a part of it so that I have that training going into practice years down the road.